If you think you might have SIBO, the only way to know for sure is testing. Here are 4 ways doctors check for SIBO. Number 1, the breath test. This is the most common way to test for SIBO, and it's simple. You drink a sugar solution, either glucose or lactulose, then breathe into a device every 15 to 20 minutes over a couple of hours. Bacteria in your gut feed on that sugar and release gases, mainly hydrogen and methane. The device measures those gases in your breath. A sharp early rise usually means bacteria are overgrown in the small intestine where they shouldn't be. Number 2, small bowel aspirate and culture. This is considered the gold standard test, meaning it's the most direct and accurate. A doctor takes a small fluid sample from your small intestine during an endoscopy and grows it in a lab to count the bacteria. The downside is that it's invasive, more expensive, and not something doctors use for every patient, so it's usually reserved for complex or unclear cases. Number 3, a review of your symptoms and history. Before ordering any test, most doctors will ask about your symptoms, your medical history, and any risk factors, like previous abdominal surgery, slow digestion, or conditions like IBS. This doesn't confirm SIBO on its own, but it helps your doctor decide whether testing is worth pursuing and which test makes the most sense for you. Number 4, a trial of treatment. Sometimes, when testing isn't available or the results are unclear, doctors will try a course of antibiotics targeted at SIBO. If your symptoms improve significantly, that response itself can support the diagnosis. This isn't a replacement for testing, but it's another tool doctors sometimes use. It's worth knowing that no test is perfect. Breath tests can miss cases or give unclear results, especially if preparation instructions weren't followed closely. Things like diet restrictions and fasting beforehand really do matter for accuracy. If you think you might have SIBO, talk to a healthcare provider about which test is right for you, and head to the SIBO Institute to learn more and explore your testing options.